Hi everyone, it's Friday afternoon and that means it's time for Mom Talks here at St. Louis Children's Hospital. I'm Kendra and I am so excited that you're with us here this week. We have a great conversation coming up. We're going to be talking about giving your children medicine, or as we were just talking about off camera, the tackle. The tackle and administration of medicine. So there's a lot of questions that are going around. We obviously want to make sure our kiddos, one, that we get them feeling better, but also that we're being safe. Medicines are nothing to play around with. So just making sure we've got our dosing information correct and the amount of time that has to go by before you give each dose, just all of those really exciting different topics. We're going to be taking your questions throughout this episode, so if you're wondering about something or you're asking for clarification, please go ahead, type those in, and we'll get those going throughout the episode. So I am joined by Caitlin Lukey. She's a clinical pharmacist here at St. Louis Children's Hospital. So can you tell us a little bit about what your job is like as a pharmacist here in a hospital setting versus, like being one of a pharmacist we would see like at a Walgreens or something like that?
Absolutely. And my job actually is even a little bit different than what most people think of pharmacists doing.
Sure.
So as a clinical pharmacist, I work specifically in a hospital in one particular unit. So I actually work in the pediatric intensive care unit. And I work specifically following all of those patients, and I round with the physicians every day and make recommendations about their medications and adjustments, or make sure that we have all the medications we're using are appropriate for that patient. And then other pharmacists within the hospital working actually in the inpatient pharmacy are verifying all those orders that all the physicians put in, make sure they look appropriate, make sure that we draw them up appropriately, the technicians that are making them, and checking all of that work before they get sent to the patient. So a little bit different than both a retail pharmacist in like a Walgreens per se, or from a pharmacist working in an inpatient setting. So I work a lot closer with the actual patients and their families.
Such an important role to be playing here at the hospital. So I guess what a lot of parents, especially new parents, probably wonder is, if their kiddo gets sick for the first time, are they old enough to even start taking medicine? So at what age can you start even with medicine to begin with?
Sure, that's a great question that a lot of parents would have. And really, I would say it depends on what the medication is.
Sure.
For example, pediatricians will recommend giving vitamin D to your infant, and that's okay. Day of life 1, you can start giving your vitamin D. But when we're thinking about things that are treating illnesses, something for a fever or something to help them make them feel better, we need to wait a little bit longer. One of the reasons would be, so in any neonate, so we consider that to be any child less than 4 weeks old, it can be really concerning if they have a fever. It could be a sign of a very serious infection. So for that reason, we never want to treat their fever at home and mask those symptoms. So for any child that's under 4 weeks old, if they have a fever, it's really important that they're seen by a physician. Outside of that, as long as, especially if it's recommended by your pediatrician or if they're a little bit older, it's okay to give, Tylenol or ibuprofen if they're older than 6 months is okay. Aside from that, cough and cold products and things like that, the FDA really recommends that you don't start giving those until your child is at least 2 years of age.
Wow.
And the reason for that is kind of twofold. So one reason would be that there's not a lot of data to support how those medicines work in children that young. As you can imagine, not many parents want to sign their less than 2-year-old up to be in a study.
Yeah.
So we really don't have a lot of data to tell us how they work in children that young. And then also, a lot of the common household cough and cold products are combination products.
Yeah.
And not every medicine that's in there could be safe for a child less than 2. And they also, a lot of them have acetaminophen, which is the generic name for Tylenol, in that combination. And parents may or may not realize that and end up giving a cough and cold product like Dayquil, for example, is something we're used to taking as adults. And then they give them Tylenol on top of that because they think they have, their throat hurts or something. And they end up getting a double dose of Tylenol, which can be really harmful.
That is really scary.
And so the reason that FDA put that warning out is that we have seen children under 2 have adverse effects from getting over-the-counter products. So you want to wait until they're over 2 to administer anything like that. If they're under that age, I know they're still going to get coughs and colds and have these kind of symptoms.
Especially right now.
Yeah, especially right now. So other things parents can do and think about, you can use cool mist humidifiers, you can use saline nasal drops if they're congested, or the kind of gross nose Frida, but it works really well.
Tried it. It's amazing.
It works really well to suction out all of that snot and help them breathe a little bit better. So things like that are acceptable. And then If they're over 1 for cough, you can use honey or, something to just kind of coat the throat. But I say over 1 specifically for that because under 1, children shouldn't have honey because of a risk of botulism toxin.
It looks like we do have a question.
So one of our viewers wants to know what the difference between children's Tylenol and infants Tylenol is.
Sure, great question. And actually in the drug itself, there isn't a difference between Tylenol, children's and infants. They several years ago mandated that the concentration be the same for both children's and infants. The difference really that you're going to see when you go to purchase these products is the packaging and how you can administer it. So in infants, you're going to get that nice little syringe to draw up the small dose that you need and draw it up appropriately so you're not giving too much. And in the older children's Tylenol, usually you're getting a cup and you can't accurately measure a small enough dose for infants with that.
Okay, so given what you were just saying about the age requirements for even taking medicine, when you look at dosing recommendations, especially for kids that are really little, I always notice that it's by weight. So can you talk a little bit about dosing and how do I know?
Sure. So I first would always recommend to follow the labeling that's on the manufacturer's box and on the bottle and follow that weight recommendation. And if it's not there or you can't find it, you toss the box and the label is peeled, that can happen. I would call a pharmacist. You can go to any pharmacist at any retail setting, and they, I'm sure, would be happy to help you dose. You can call your pediatrician because we do dose children by weight, as opposed to adults. You and I could just take the same dose of Tylenol, even if we don't weigh the same amount, and it would be safe. But in children, because they're so small differences can be a big deal to them. So it's really important that we do use that weight-based dosing in them.
So there's ibuprofen and there's Tylenol. Those are, the two that are most commonly out there for just about everything. As a pharmacist, is there one that you like better than another or might be considered safer or anything like that for kids?
This is a great question, and a lot of people have the same question. So there have actually been some studies done trying to determine that. Is one better than the other? Does one make a fever come down better than the other or treat pain better than the other? The answer really is no. None of the studies that have been done have found any difference in efficacy or safety between the two. So either should be fine. Oftentimes if a child that has a fever that isn't coming down, you can alternate the two and give and you'd be using both, and that may be beneficial. But I personally use both with my child at home. It may even come down to flavor and taste. Some kids will take one and not take the other, and I would support that.
So a lot of times, we hear about cough, we hear about, yucky head congestion, fun things like that. But there are some things that just medicine really isn't gonna help you with. Like, stomach bug, they say you can't cure stomach bug. What are some other things, like just common symptoms out there that, frankly, medicine's just not gonna help you? Sorry.
Sure. The biggest one that comes to mind, and I think of a lot, is viruses.
Yeah.
So we can treat the symptoms that you get with a common cold or a virus. We can try to alleviate a cough. We can alleviate the aches and pains and the fever. But bacteria are really the only things that are going to be killed with antibiotics. So I think a lot of parents think that a cold can be treated with antibiotics and then my child will get better quicker. And that's really not the case. It just has to take its toll, and the body recovers on its own, and antibiotics really aren't going to do anything for a virus.
So if my kiddo is sick, like say has a fever or a cough and things like that, is it okay to give them medicine every day? Or at what point should I be like, okay, it's been several days of straight regular medicine, maybe we better call a doctor?
Yeah, so I would say for a couple of days it's perfectly fine to continue giving medication. Times that I would be concerned is if the fever is really high. So I would think when it's, when you're approaching 104, 105, things like that, I would be more concerned and probably want my child to be seen. Or if I've given Tylenol or ibuprofen and the fever has come down and then it comes back and I have to keep giving it for several days, I'm thinking 3-4 days. And at that point, I would probably want to make sure that nothing else was going on. And I'd want my child to see a pediatrician.
So let's talk a little bit about how would I give my child medicine when they don't want to take medicine?
Sure. This is a fun one for all parents.
Gymnastics.
Yeah. So I think of children in kind of two categories. We have our older kids that maybe we can reason with a little bit and explain to them the purpose, and maybe we can bribe them or come up with an alternative way and get them If they're a little bit better with their swallow, maybe we can work on taking tablets or capsules that are typically more palatable than some of the liquids. But in our younger kids that, I have an 18-month-old, I can't, make him understand why I want to give him this yucky medicine. In that case, you really do just kind of have to do the hold. And I find that, I'm usually, if I'm at home by myself, I kind of grab him, I get his one arm behind me so he can't move that arm. I got my other arm kind of around his head, and I'm holding his other arm there, and then I kind of, get the medicine in his mouth there, and you kind of get it in the back of the cheek so that it, in a little bit at a time, so that they're not choking on it, and not spitting it all out. So that's how I tackle it. It tends to do the trick, but there aren't a lot of great ways, and you can try, making it taste better, because that can be one of the big concerns. Chocolate syrup tends to be the best thing at masking bad flavors.
You heard it here. Can I do that too?
Sure, yeah, whatever it takes. That can be really great at masking the flavor. But I would caution against putting it in a bottle or putting it in your formula or your milk, because chances are then they aren't going to end up finishing that bottle or that cup, and then they won't get their full dose. Or you just may end up giving them an aversion to the bottle they previously took because they think, oh, that's yucky, I don't want it. So I would recommend against that. But some things you can sprinkle on some applesauce or things like that if your child is old enough to take that.
That's good advice. So for some cases, you are going to have to come in and get antibiotics. Can you explain a little bit about what antibiotics are and what they do?
Sure. So antibiotics really are targeted at killing bacteria. So different antibiotics have different, what we would call spectrums of activity. So what types of bugs they kill. So really the point of them is to eradicate bacterial infections from the body. So like I said, they really aren't going to help with viruses. But they do help with bacteria as long as we have the right drug treating the right bug. Another really important thing is making sure that you finish out the whole course of antibiotics. And the reason for that is this idea that resistance can occur if you don't finish the course. So what happens is if you don't, say for example, you're supposed to take the antibiotic for 7 days, and by day 5, my child's feeling better, they're acting okay, it's a real struggle to get the med in, so you just say, I'm going to forgo those last 2 days. What happens then is that there's a kind of bacteria still hanging out in the background, and then they now learn how to overcome that antibiotic that you've given. And so then subsequent infections are more likely to be resistant to that particular antibiotic. And over time, you run out of antibiotics to use if they keep becoming resistant. And this does happen. We see it happen in our patients and across the world. So it is something to be aware of, and that's why we really emphasize to finish your whole course of antibiotics.
So 10 days, twice a day, sometimes stick it in the fridge, and it's part of the life for a little bit.
Is.
Wow. So what should I do now? Every parent of the baby and toddler is screaming this question right now. My baby, I gave them their medicine and it came right back up.
Sure.
So did they get it? Can I give it again, or do I have to wait?
So the rule of thumb that I typically use is 15 minutes. So if I've given it and they spit it right back out, I know they didn't get the dose, and it's okay to go ahead and give a second dose and repeat that. If it's half an hour later and then they vomit, I wouldn't repeat that dose, because I would expect that they probably absorbed at least part of it by then. But if it's within 15 minutes that they spit it back up or throw it back up, then it would be okay to go ahead and give a repeat dose.
Okay. So one last question. A lot of us see medication labels with expiration dates on them. How hard and fast are those rules? When should I throw them out, or when can I just give it to them if that's what I've got in my medicine cabinet?
Sure. So it depends on what it is. So with things that, like antibiotics that are mixed up in the pharmacy, those really should be thrown away after the expiration that's written on there, because they're only stable for a certain amount of time. It's usually 7, 10 days, something like that, when the pharmacist will write it on the label. So those really should be thrown away after that time. Other things like a prescription that we fill that's tablets per se, that would be good for a year after it's filled. And then things that we buy over the counter that has a manufacturer's expiration date on it. So those tend to be longer, usually it's a couple of years. But if it's lying around and it's past that, I would ask, how far is it past? You know, I am guilty of, you know, using things that maybe just a little bit past the expiration, knowing that it's very unlikely that it would harm you to take something that's a little bit past the expiration date. What's going to happen most likely is that it just doesn't work as well. And it's losing its stability, and it's just not working quite as well. And then certain things like eye drops, per se. You know, if you've got a bottle of eye drops, and because your little guy's got pink eye, a lot of times when you're giving that, you end up accidentally, even as much as you try not to, the bottle ends up touching something that probably is infected. And if you let that sit around for a while, and then you reintroduce it, really not a good idea.
Okay, thank you so much for your expertise.
Sure, thanks for having me.
So that's going to do it for us on Mom Talks today. Thanks for joining us. So next week, we're going to be doing a very special episode on running injuries and the benefits of running. We're going to be doing this in partnership with the Girls on the Run. They have an upcoming race coming up. I'm super excited. I love to run, so I'll be excited to jump into this conversation with Girls on the Run and also with our physical therapists at the Young Athlete Center at the Specialty Care Center. So we hope you'll join us, and we'll see you then next Friday at 11. Have a great day.